My name is Mina Barling. I'm the Director External Relations at the International Planned Parenthood Federation, based out of London. So the biggest trends we are noticing at the moment in sexual reproductive health and rights is we are at the crosshairs of a very well coordinated and very well funded campaign against women's bodies. We, of course, saw this in the US with the election of President Trump. And of course, in his first week in office, he rolled back women's rights via the Mexico City global gag rule. And what this means is that organisations that were tasked with serving women life-saving services were no longer able to. We've also seen an increase in opposition against women's rights and women's health care, much broader than that. It's a global phenomena. At the same time, we have seen an increase in response to that in socially led grassroots movements. So we saw it with the largest ever women's march. We have seen it with the rise of movements like She Decides and a lot of other work happening around the world. This has really significant implications for sexual reproductive health and rights. It means that previous wins that we took for granted are now being questioned, and we are having to fight for what felt like long ago won rights to particular services. And we see this in a country, say including India. We see as well here that it has really mobilised many community groups who are now urging their society to better respond to their needs. So I think India has made tremendous gains. We see this recently in the decriminalisation of sexual identity. So a long-held colonial law was challenged. We see it in reducing maternal mortality. But what a lot of organisations are still working on here is ensuring healthcare goes beyond the medical model, goes beyond this paradigm of the mother and baby, and that the fullness of sexual reproductive health and rights is fully recognised and realised. So that includes the rights to comprehensive sexuality education. That includes the right to safe services for all women, including those that are younger, unmarried women, and women that live on the margins. Women here are also asking for services that reach them in harder to reach areas and for populations that have previously been underserved. So interestingly, the International Planned Parenthood Federation actually has a long relationship to India. India is one of the founding members. We have been around for a very long while. We've always been focused on access to services for women, for adolescents. We have a long history in ensuring access to contraception and also safe abortion. We have many years of experience in ensuring that our programs are able to respond to gender-based violence. We have been involved in comprehensive sexuality education, and we've also been involved in the work I mentioned before around movement building. We have a proud history of volunteerism, and many people that have used our services also go on to become activists and part of our movement. We're built on our grassroots organisations. India, but in many countries, this is an area where we have spent a lot of time and effort, but it's also can be a very challenging area. We know that when we speak to young people, that they are very interested in having information on healthy relationships. They want to know more about gender and their roles. They want to know more about, for young men especially, they want to understand more about their role in terms of being good role models, in terms of treating women respectfully. Young people want to talk more about sexual identity and what it means for them. And also they want the right to talk about respectful relationships and the right to sexual pleasure and freedom as well. So we have been in India for more than 60 years. We have been part of the national dialogue on ensuring access to contraception and safe abortion. We have a proud history in really driving the discourse around what quality of service looks like, on ensuring that our service provision is at a standard that women want, that we actively engage women in the design of our services, and also that we reach adolescents and young people with our services. So our future plans are to continue with service provision and making sure that women, men and adolescents have access to the full range of services. Going forward, we are really focusing on ensuring that that basket of goods for services includes newer methods. So for example, we're very interested in methods where women have much more control over the service provision, and that includes contraceptive methods that women can self-administer. It includes the self-administration of medical abortion, so now women can safely take pills to end their pregnancies. We also are very interested in doing more on access to education and ensuring young people work with us to design what the service landscape looks like for those communities.